Hello everyone, my name is Dhruv Tilawat and I am from BPT first year student. So my today topic is sternoclavicular joint. So in this video we have to see which type of joint it is, the articular surface of this joint, ligament, blood supply, nerve supply and the movement that happen in the sternoclavicular joint. So first we have to see which type of joint it is. So it is a synovial joint and more specifically it is a saddle type of joint. Why saddle type of joint? We have to see later in this video. Now we talk this joint is a compound joint because three elements take part in this joint. The first one is the medial end of clavicle, second clavicular notch of the mandibular sterni and the upper part of the first costal cartilage. So it is also a complex joint because the articular disc is present, and because of the articular disc the cavity is separated into two compartments, superior medial and inferior medial, and because of the articular disc present, the articular disc will separate the clavicle and sternum. Now we talk about the articular surface of the clavicle. So the articular surface of the clavicle covered by the fibrous cartilage, and now we talk about the surface. So the surface of the clavicle is convex from above downwards and concave from front to back, and because of this concave convex surface, this joint is known as a saddle joint. Now we talk about the ligaments. So there are basically three ligaments present in this sternoclavicular joint. The first one is intraclavicular ligament, second costoclavicular ligament, and the third is sternoclavicular ligament. Sternoclavicular ligament are two types: anterior sternoclavicular ligament and posterior sternoclavicular ligament. So now we talk about the intraclavicular ligament. So the interclavicular ligament passes between the sternal end of the right and left clavicle, and the some fiber of the interclavicular ligament also attached to the mandibular sterni. Now we talk about our second ligament, costoclavicular ligament. So the costoclavicular ligament attach inferior aspect of the medial end of the clavicle and the upper border of the first costocartilage. Now we talk about the blood supply and nerve supply. So the blood supply of the sternoclavicular joint are by two arteries. First one is internal thoracic and second is supracapsular artery. Now we talk about the nerve supply. So the nerve supply is done by the medial supraclavicular nerve. Now we talk about the movement of the sternoclavicular joint. So the movement are best to understand. We have to see the lateral aspect of the clavicle. So the movements are present in the sternoclavicular joint are the retraction, protraction, elevation and depression. And we talk about the clinical anatomy. So there are the injuries are very uncommon at this joint, but there are some injuries because of the sudden fall and the car accident happen. So this is all about the sternoclavicular joint. Thank you very much.